Hello, I'm Bill Botel and welcome to episode 7 of Clocking Corona. In this episode, I'd like to look at global and national pandemic planning in the years and months leading up to the emergence of coronavirus about late 2019. Particularly, I'd like to look at the national pandemic plans that were created over those years. Now, of course, there is nothing to be said against the creation of national pandemic plans. But in this case, I believe that many governments made a very fundamental error in that they were planning that the next viral attack in the world would come from a new variant of influenza and not, as it did, from severe acute respiratory syndrome or SARS. Over recent years, in response to the emergence of SARS-1 in the early 2000s, MERS and Ebola, many governments started to update pandemic planning. But somewhere along the line, the lessons of SARS, MERS and Ebola somehow did not translate into the pandemic plans that were put together in Australia and elsewhere. Perhaps that was because only a few countries in Asia and Africa had had first-hand experience of the devastating impact of SARS-1, MERS and Ebola. By and large, these diseases did not register in any large way in the richer countries in Europe and North America and Australia. I think that those countries constructed a plan for a pandemic based on what they knew. That was the ordinary seasonal recurrent outbreaks of influenza, sometimes new strains that were more or less virulent than the previous years, but something that could be comprehended and managed easily. The idea that we might be facing a viral pandemic of a very different nature to influenza from SARS-2 was somehow discounted or lost in the national pandemic planning. Now, we know that SARS-2, coronavirus, COVID-19, is not influenza. As Professor Michael Baker, the architect of the New Zealand response to coronavirus, said in an interview that he gave to Dr. Norman Swan on the Health Report on 13th of April, the approach to SARS control is the exact opposite of how we must deal with influenza. With influenza, you deal in a graduated and proportionate way. You see where the outbreak took place, you take the next step to isolate or quarantine, and you move in a proportionate and sustained way to bring the epidemic under control. But as Professor Baker said, when you deal with SARS, ideally you stop it at the border. And when it appears, you go in hard and fast with every tool in the armoury. Isolation, quarantine, testing, so that you very quickly establish control over the virus, and you take it very seriously indeed. Stop it at the border, and if it gets into your country, be very vigilant and move with everything that you have. That's the difference between influenza and SARS. And with influenza, of course, we have a herd immunity, generally, and a vaccine is never really very far away. We know that year after year and decade after decade. But when we planned for a pandemic, I think our planners looked at influenza, at the influenza paradigm, and they didn't think hard enough that the next one that might come along would be SARS-2. Now, SARS-2 has very long-term debilitating impacts even for those people who recover from serious illness. We only have 5 months' experience of SARS-2 in the world, and many reports that people are not just suffering severe lung distress when they recover, but that the disease might also affect hearts and kidneys and even the brain and cause cognitive difficulties. It is a very serious disease and one which we should never want to let run in our countries and the world. To combat it, we must take a hard and fast approach, not light and slow. It's very important that as we upgrade our pandemic planning, we take full account that the next viral challenge to hit the world and to come to Australia might be SARS-3. Hopefully it's years and decades away, but it will come, and it might be a matter of weeks and months. We can't afford to get it wrong the next time. Thank you.